One key plank in today's health blueprint is the proposal to set up a national network of so-called primary healthcare centres. The Health Reform Commission says the centres would offer patients a whole range of health services they can't get from their local GP, including 24-hour emergency care that would help ease the burden on public hospitals. Apart from offering support for the growing numbers of chronically ill Australians, they are also aimed at helping people actually stay well. Deborah Cornwall reports.
Possibly 1 in 5 people in a hospital at any given time could be better cared for elsewhere.
The model they're using is an ancient one. Some bits of it, particularly the public hospital model, is a 19th century one. We're like an old house that's been built up over many, many extensions.
For decades, policymakers have wrestled with how to make the healthcare system more about keeping people well and hospitals the place of last resort.
When we turn to a hospital for reassurance and safety, our nervous and emotional reserves are often close to exhaustion. Drained by the personal crisis of illness, we're confronted with the sometimes grim exterior of a hospital.
In the 70s, it was community healthcare centres that were hailed as the new panacea, a visionary scheme by the Whitlam government that was largely resisted by the states and never quite got off the ground.
This is Maureen. Come on through. I had you for 3 o'clock.
But 40 years on, the Rudd government is now contemplating rolling out a bigger, better version of the 70s model, the so-called one-stop health shop, the primary healthcare centre.
Primary healthcare care in the community by a range of clinicians is the platform that we want to build the new health system on, and the comprehensive primary healthcare centres are one of the tactics, if you like, of making that visible and easy for people to get to and offer them everything they need under one roof.
The National Health Reform Commission has recommended the Commonwealth set up a national network of large primary healthcare centres. A move, it says, would ease the burden on hospitals and keep people healthier for longer.
There are examples of the sorts of centres we're talking about to some extent in the private sector at the present time, and there has been a lot of consolidation of smaller GP practices into bigger practices. We're suggesting go one step further and include some of those really urgent care services like radiology, plastering, minor procedures.
Primary healthcare centres may not sound quite as exciting as a federal hospital's takeover, but the Commission says they'll pave the way to a fundamental change in the way we use the health system. They'll also mark the end of the small GP practice. Victoria is the only state in the country where a wide network of community healthcare centres have continued to operate since the Whitlam years.
And you're seeing the doctor on Wednesday, aren't you?
That's right, yeah.
Right, so we'll do it again.
The centres are run on a team-based approach, which allows patients to be treated by their regular GP, along with a range of other health professionals, offering everything from physiotherapy, mental health counselling or podiatry, all in the same centre.
The day of isolated single-person GP practices is well and truly over. And I think there's increased recognition that one practitioner, whether it be a GP, a nurse, a dietitian or a podiatrist, no one practitioner really can provide all the care that every person needs.
Health Administrator Rod Wilson says one of the major weaknesses of small GP practices is that patients have to be referred to a raft of different health specialists and are generally forced to traipse across town or join long waiting lists. And too often the system is so bewildering they miss out on treatment altogether.
Using the healthcare system as it currently stands requires a high level of health literacy, a high level of health education about what you're entitled to, and by and large that system gets worked by the middle class. And it really is a national disgrace that people on lower incomes in this country are destined to have much poorer health outcomes than those people who are wealthy.
But health experts are divided over whether primary healthcare centres can be expected to do all the heavy lifting in healthcare, from keeping the chronically ill away from hospitals to promoting better health in the wider community.
We'll continue to have far too many one- and two-man GP practices that are inefficient and unable to offer people the prevention strategies. And Australians will keep desperately looking around and swallowing $2 billion worth of vitamins that go straight down the toilet every year, trying to neutralise an unhealthy lifestyle, because no one's really helping them with factual knowledge about how to stay well.
The thought that somehow or other people are going to come to a kind of health supermarket if they've got really serious problems, that needs to be tested.
Professor Stephen Leader says while there's certainly a role for primary healthcare centres, policymakers can't simply assume people will want to abandon the small corner store model of the local GP, currently serving up to 40% of the population, in favour of larger health centres.
The indicators that I can see are that most people are satisfied most of the time with the services they receive from their general practitioners. So we've got to be careful to preserve that and not run roughshod over it.
We're all good to go.
But such is the strain on healthcare resources, reform advocates fear the Rudd government will not go nearly far enough to deal with a dysfunctional health system that can no longer manage the demands of an ageing population and increasingly expensive technology.
It's very unfortunate when public policy is made on the run in response to crises. That's why really in healthcare, which has built up such complexity, so many inequities, so many inefficiencies over time, we really do need to go back to the beginning and redesign from the ground up.
Primary healthcare centres, say experts, may well divert some people out of the hospital system, but with the chronically ill and elderly currently taking up well over half the acute care beds in public hospitals, that's a challenge that is unlikely to go away anytime soon.
I have a problem with the idea that somehow hospitals have become so specialised and so focused on acute care that for average people, they're no longer the place where you go if you've got a serious problem. They're not adventure playgrounds for health professionals. They're there to serve the needs of people.
Deborah Cornwall with that report. As John Howard's Health Minister, Tony Abbott